Assalamualaikum. Good day, everyone. Welcome to my live streaming. And our topic for today is infection control program and COVID-19 precaution during vaccination. I'm Irene from Infection Control Department. Would like to welcome you to our first live streaming. Before we proceed, before we proceed, I would like to know you regarding the lecture room protocol. First, wear your surgical mask, wear social distancing, and those staff cannot come inside the lecture room will be provided the link that I forwarded now in the GC group. Hello, did you hear me? Is there any action for it? Miss City, did you hear me? Hello? Hello, hello. Hello? Okay. Hello? Hello? I'm back. Did you hear me? Any comments? Hello? Can you check me, Miss Titi, regarding on my sounds? Okay. Anyway, I will start this now. I will start this now. Again, to those staff cannot come on this lecture will be provided a link that I provided with Miss City with me today to help me to all the group. And tomorrow, if I come to you, to those staff, and I will ask you, you must be provided me the name that you are present on the chat board. Okay, let's start. Okay, infection control program. I'm Irene from infection control. Would like to present you this topic. Okay, organizational structure. This includes your infection control department vision, mission, and values. Infection control committee, terms of references, your statement of authority, ICC representative, what's that? Infection control committee representative. Like now I have with me with Miss City. Infection control department organizational chart and staff job description. Who are they? I will discuss to you about them, inshallah. In infection control department, your mission and vision, I will tell to you our mission and vision. Okay, let's begin. Our mission task is to protect patients, family visitors, and who is the visitors? You are with me. Those who are with me now, welcome, my dear visitors. Volunteers, suppliers, and students, and healthcare workers against the healthcare acquired infection and communicable diseases, and the importance of maintaining what? Your own health. Vision is effective partner in the prevention and control of disease with well-informed, skilled, and dynamic staff. Values, sensitivity, cultural diversity issues, and understand cultural considerations for patient care. Now, in our infection control, we have committee. What is your committee? This is your committee regarding your facility. In committee, first, like what I did last week ago, as a part of my responsibility, you should have first a memo to inform them and how many days. 2 to 3 days, inform them your memo. This called outgoing memo. And what's the included to your memo? Of course, meeting agenda. Type of meeting, the date, what time, meeting location, infection control chairman must be present because meeting called by infection control chairman. And then bring this agenda during your meeting day. What's the topics? This topic is the concern on your departments, what's the issue that need to be solved. And according to the standards and substandards. And then you will give your members for the receiving copy of meeting agenda. Now, in the committee of terms of references, is this the same? Who will comment below? Terms of reference composes of name, committee name, reporting to who you will report this? Of course, your CEO. And the date form. And then you should have membership. Who are the membership? The chairman and the co-chairman. If the chairman is not available, your co-chairman will be responsible. And this is according to the choice of the chairman. Of course, your members. Your members first is according to your departments. Second, the head of each department. All. And what is the purpose? To ensure that there are systems in place to reduce the risk of hospital-acquired infections, manage the inevitable ones, and move towards an attitude of zero tolerance of HAI. What is HAI? Healthcare associated infection. Your duties according to function of the team include necessarily restricted to the following. Approve and revise the annual plan. That's why if you have infection control program, you should be guided of what? Your annual plan. And since this is the first of the month, you should have this in the whole year, in the 1 year, sorry. Ensure compliance with the hygiene code and care quality regulations. Work in partnership with patient-safe group reducing infections. Ensure infection control principles are incorporated to all clinical and non-clinical activities of the trust. Management, new purchases and buildings. Approve and review, excuse me, infection prevention and control clinical protocols, manuals, and policy. By the way, our policy will be soon, maybe after 6 months. It was dated 2021, so after 2 years. It depends on your facility policy. If you have 3 years, you will revise this after 3 years, but it depends, as I mentioned. Establish, reviews, and approves this every 2 years. See, in our policy, this is it. Related to infection surveillance, prevention, and control activities and department services. Evaluate and review the reports of HII submitted. But then I will discuss this, the importance of surveillance. Ensure daily tasks to all my IPC linkers that I give you the collection of data as daily, weekly, and monthly. And then your KPI indicator after 3 months. And now I will collect, because it's the end of the month, I will collect your HAI report. Evaluate and review the reports of the HAI. So, committee shall advise the leadership on all matters relating to infection control. Yeah, it said committee shall advise the leadership of all matters relating to infection control. Progress leadership, executive board. Inform them if targets are not met. Advise on action that need to be taken and resources needed. Evaluates and revises continuous basis the procedures, mechanisms developed by the IPC team. Okay, brings the attentions of IPC team regarding issues arising in different departments and suggest solutions. Each member of the committee acts as an advocate of IPC on this department, trying to promote these principles and ensures application of its rules. Now, in antibiogram is regularly discussed by IPC, and we have separate committee of this. And this collaboration between who are they? Your laboratory department. Okay, roles of operations, frequency of meetings in the committee. The team shall meet at least quarterly in our committee and should indicate it, yes, as I mentioned to you on the first part, agenda. What's your agenda? This is what I did. And then inform your members. Who are the members? I told you the head of each department, which should be distributed 1 week before the meeting. But me, I distributed 3 weeks, 3 days, sorry, because I have many reports in the other sites. Additional special meetings may be held at the discretion in the presence of medical director, and relevant members discuss special issues. That's it. Now we end quorum. Quorum means 50% of the team members plus team chairpersons shall constitute a quorum. Appointed members are expected to attend meetings and participate in team activities. Okay, by the way, those you can share my link on the just click the share and you will see the link there and share it to them. Thank you. Attendance falls below 50% for any given meeting shall be rescheduled at the chairman's discretion. If the quorum is not met, what you will do? Inform who? The chairperson, and he should adjourn the meeting unless there are urgent matters cannot be ignored. The minutes must document the incidents. If the event is not that the chairperson is unable to attend scheduled meeting again, this signatory, sorry, because I make bululo, with chair of the meeting. A member shall lose their membership if absent for 3 times, maximum without apology, for maximum of 5 times per term. In this case, the chairperson shall notify the CEO or your hospital director. Meeting minutes proceedings, the meeting shall be recorded and typed the secretary of the team, and circulated to all members after initial approval by the chairpersons. Tape records ensured hand notes must be retained until final approval. Final approval acceptance in the previous minutes is obtained from the team members before the next meeting. See? Annual review. The annual review committee accomplishments and non-resolved issues is done at year end by the chairman and is submitted to the executive management. Feedback from annual review is studied by the committee and recommendations are implemented. The voting, generally, decision shall be reached by consensus. However, when discussion reveal different opinions, voting must be exercised to reach decisions. And the team is equally split. The chairperson shall have what? The deciding vote. Votes should be counted by the chairpersons and documented in the minutes. For example, agreed, disagreed, or reserved. In a form handed to members, it keeps with the records for future reference. Decisions may be deferred pending consultations, specialties in an ad hoc committee. Teams shall have the right to access and utilize the necessary resources for carrying out its duties, including participation of any hospital staff who is not members of the team. Okay, membership of its responsibilities. The member shall be expected to attend the scheduled meetings. In scheduling conflicts arise, they should notify the chairperson or designated team secretary or recommendation as required. General duties include participation of the meetings, discussion of quality service issue, review of reports, discussions of education, the training issue like this, and making recommendation as required. From the time to time, members may be asked to work on special projects or subcommittees to participate on task force goods. Minutes after will be circulated to who? To who are they? The CEO, the hospital director, medical director, and the team members. Okay, I already informed you regarding, discussed to you the terms of references. Statement of authority. Just a minute because I want to check in the monitor. Okay, the statement of authority and ICC representative. Our statement of authority is through the chairman. IPC personnel and all members have the authority under the medical staff bylaws to institute appropriate control measures when if an infection hazard is identified or anticipated that may affect the patient's visitors or employee. IPC team, yours truly, shall be notified of the potential problem and shall confer with committee members as necessary to institute control measures. Review and approve all policies and procedures related to infection surveillance activities in all departments. IPC committee has the authority for routine identification and analysis of the incidence and cause of all infectious diseases. Develop and implement a preventive and corrective program designed to minimize infection hazards. Collaborate with the leadership of your facility to institute emergency measures to prevent infections such as closure units, transfer of patients, and other measures. The role of IPC team or the role of infection control professional. Written job description of infection control duties. Responsible for implementing, monitoring, evaluating. See guys, I mentioned implementing, monitoring, evaluating to my dear staff. The infection program, infection IPC. in short, should be guaranteed sufficient time and the support of administration effectively. Other appropriate individuals that should have written authority to institute infection control measures, emergency situation, should have sufficient infection control knowledge based on carry out responsibility appropriately. Know the national, see, know the national and international regulations dealing with infection control. Should communicate with relevant committee for all and personnel within the administration. Okay, ICC representative is the one if will provide the task if the one staff in the IPC team is not available. That's the short term that I will give now. Okay, organizational chart. This organizational chart, it depends on your department who is the availability of the staff. For us, we are okay now. We are complete. We have board of directors, the general manager, and the IPC team. Your staff job description. The staff job description came from collaboration team of the HR department. They will want to provide us the signatory for it. Next. Yes, this is it. Staff training. Now we are in the first month of the year. Now we are conducting the staff training for educational program. And as I told you, we have protocol in the lecture room. So I think I can only accommodate maybe 20 persons, but doesn't mean you will not attend, but you can provide our media forum on the link. Inshallah, maybe next time you will all appear here. And then in the staff training, there is internal, yes, that's what I mentioned. Internal regarding your facility membership. External students. Staff orientations. In our staff orientation, if you are newly hired, we have an hygiene program, PPE, blood body fluid spill kit management, sharp disposal, and it will give you the orientation will be held in the infection control office, and now we have Mr. Asiri, and regarding of it, now he was conducting those that I mentioned. New recruits means the newly hired, the new coming, and the reorientation means either you are old or new staff. Why? In infection control, you need to be always, you reorient them. Not because even me, as I'm old staff, it doesn't mean I will not attend. It must be always, you must be updated. That's why reorientation. Like now, I'm doing now the orientation for the start of this lecture here in the lecture room. Okay, section 3, surveillance and management of HAI. As I mentioned already here. And this that I will mention to you on these slides, I will just a brief description only, because in time, inshallah, if there's another chance, in time, not sorry, it will discuss to you. BAP, ventilator associated pneumonia. The surveillance done according to updated CDC, and CDC is our communicable diseases center criteria to be followed. BAP, ventilator associated pneumonia. CLABSI, central line associated bloodstream infection. CAUTI, catheter associated urinary tract infection. SSI, surgical site infection. And MDRO. What is MDRO? Is multi-drug resistant organism. This is the non-devices among the surveillance. Among the surveillance. Multi-drug resistant organism. Clostridium difficile. Later, I will give you a video. We have huge presentation for it, and then you will see how you acquired this CD. Outbreak investigations, surveillance of emerging and re-emerging infections, communicable, communicable and reportable diseases to MOH. Yes, this is my daily task. Reporting to them. Reporting to them as daily, weekly, monthly on your dashboard. The dashboard that we have is our regular monitoring for the, of course, our data, daily data, which is we call emergency crisis. And then my GDAPC, General Directorate Infection Prevention Control Reporting, like hand hygiene program. And yours truly also the coordinator of this program. And I have daily dashboard. And then evaluation after a month. And another is your health electronic surveillance system, which is our entry for our COVID entry data for COVID patient. And this will be discussed on the last part in our as mentioned as special areas, critical areas. Just only know, of course, my support regarding the assessment of this. And I will, actually they know already, and good for the ER department because they are following their protocols. They are very active regarding the assessment. Distribution of data to concerned department and hospital leaders. See this one. I will check first the targeted surveillance. I mentioned SSI. This is a specific reporting of total cases. Primary data source is the surgeon reporting letter group. Daily review of microbiology report for positive cultures that in collaboration with the laboratory department. Assess the invasive procedure and surgical safety. BAP, ventilator associated pneumonia. Daily reporting in critical unit identified case according to the CDC criteria. And we have checklist for this. What is the BAP that it's according to not all departments are applicable this case BAP. And next time maybe I will another topic for it. Because if I discuss this today, maybe we will longer more than hours. Central line associated bloodstream infections. These detections of monitoring of microbiology reports, positive cultures, electronic medical record review, determine whether bacteria Present the data of the Infection Control Committee monitor the bundle checklist. Yes, we are applying this and we are have a bundle checklist daily, weekly, and monthly evaluation. In outbreak investigation, I just only regarding only the what is the outbreak investigation and control. Surveillance data should be used to detect and prevent outbreaks. Surveillance and monitor must be targeted to specific needs of the organization. Results should be accompanied by the action plan that will lead the quality improvement. Clusters, outbreak trends, and patterns will be investigated as identified. Identify the factors that contributed to outbreak in order to develop, implement measures to provide similar outbreak in the future. Infection control and along the infection control personnel and medical director, the authority to institute practice necessary to achieve immediate control of outbreak. Work closely with severe and resource the housekeeping supervisor and departments regarding cleaning and disinfection procedure. Perform epidemiologic studies with appropriate based on surveillance. Investigate adherence issues, infection prevention procedures. Institute appropriate corrective measures and advise hospital staff for prevention procedures. Serve as information resource for all departments. Order an environmental culture needed as needed only from appropriate personnel during targeted epidemiologic investigation. Develop plan and culture transmissions of infection during an influx. Employees health immunizations. Anyway, this employees health will be another task that I will provide you next time, inshallah. Next. Section 4. Risk reduction and prevention of infection practices. Now, is it clear? How many have we have precaution, standard precaution, and expanded precaution. In standard precautions, number 1, your hand hygiene, PPE, and initiating discontinuing isolation precaution. And transport of patient and isolation is very important because in the last few months, this what I mentioned today is very, very applicable. Expanded precaution, your airborne isolations, contact isolation, droplet isolations, negative pressure rooms management. This is in your isolation area. Single room isolations and non-negative, and patient sitters and visitors. Okay, standard precaution. I go back to this. I will show you a video regarding first the hand hygiene. May echo. Ang galing mo.
For example, perform hand hygiene after touching a monitor.
May echo ba eh. Minsan kasi may echo. May stop na tayo. Ang pangit ng sound. Ang pangit dito, oh. Sa cellphone. Sa cellphone. Sa'yo? Okay na? Dito. Okay, thank you for coming.